Thank you very much. And thank you, Walter Bushner, for having me here. And I'm really afraid to see the women power. And I'm the lone endocrinologist to start my talk. But nonetheless, the topic is very interesting, and all of you have used this molecule in your day to day practice. So these are some of the outlines. I'm starting with the introduction. What are the pleiotropic roles? What is the role in the reproductive, OBG, obstetric care, gynecology, menopause, the formulation revolution, and the simplified dosing, summary, and conclusion. Now, just a little bit of epidemiology. Vitamin D is the most important nutrient in our body. It's a prohormone, crucial for the systemic regulation and primarily synthesized via the UVB radiation 80 to 90% or obtained through diet, fatty fish or the fortified foods. And our country being mostly the vegetarians also, we get hardly any people taking fatty fish and fortified foods. Exists in the nature in two forms, the D2, the ergocalciferol from the plants, and D3 from the animal sources and the skin synthesis. If you see the Indian paradox, despite being so much a sun-rich nation, we have almost 99% patient having vitamin D deficiency in our country. And this is not exaggeration. And I think sometimes I just studied the vitamin D in our medical profession in our hospital, the Apollo Hospital. I think almost all of them having the vitamin D deficiency or insufficiency. So this deficiency persists regardless of the socioeconomic status or geographic location. India is a heliophobic nation. We try to cover our body because we should not get the sunburns or your face should not get spoiled. And the cultural factors, the protective clothing, environmental barriers, high air pollutions, particularly in city like New Delhi, which blocks the UV radiation. Dietary habits predominantly, I said, the vegetarian diets lack natural vitamin D sources. Some of the numbers we have to remember that deficiencies when the vitamin D levels are less than 20 nanogram, insufficiency between the 20 to 30, sufficiency more than 30, and optimal for the extraskeletal benefit is 40 to 60. We are fortunate enough that each and every lab in our city of Delhi is having the facility for the vitamin D assays. What is the classical role of vitamin D in the skeletal integrity? I recently published a booklet on vitamin D and the skeletal health, which is going to be released shortly. And the vitamin D basically promote the intestinal calcium and phosphate absorption, which is essential for the mineralization. And listen, deficiency leads to a 2 to 3% higher rate of osteoporosis in Indian women, critical for supporting peak bone mass during adolescence, which is the greatest factor of having your bone strength later on in your life. And defining the pleiotropy, what we are talking today, vitamin D receptors. We have to know about the vitamin D receptor, which is expressed in almost every tissue in the body, including the ovaries, uterus, and the placenta. And it regulates over more than 200 genes in cell proliferation and the immune function. Few decades back, we were having vitamin D. Oh, what is this vitamin D? One molecule, just we don't know. Most of the assays were not available those couple of decades back. Now, with the wider availability, we now know the prevalence and the importance of the vitamin D deficiency and insufficiency. Coming to the in front of the women power, the reproductive health, it supports the ovarian function and healthy follicular development. Crucial for the endometrial receptivity, vital for the successful implantation. Deficiency, which is less than 20, is associated with 1.5 to 2 times higher risk of infertility in Indian. I think this is one of the important factors which should be included in the teaching. What is the metabolic health? The vitamin D is also important in glucose metabolism via VDR expression in the pancreatic beta cells, improves insulin sensitivity, reducing the risk of developing type 2 diabetes. So we don't know if it is a direct cause and effect, but we still know that there's enough scientific evidence to tell the vitamin D role in the glucose metabolism. Coming to the cardiovascular health, coming to the blood pressure, the sufficiency linked to 20 to 30% reduction in the hypertension risk, prevents endothelial dysfunction, reduces the arterial stiffness. You can see the pleiotropic impact of the vitamin D as anti-inflammatory, vascular rigidity, smooth muscle proliferation, hypertension, endothelial function, lipid-lowering effect, and improve vascular tone. So on the left-hand side is improve, and the right-hand side is the prevention of certain metabolic pathways. Now coming to the immune system, which is most talked about the action of the vitamin D, we know the vitamin D enhances the innate immune response against the pathogens, particularly vital in high burden regions like India for reducing the infection risk. Level more than 30 nanogram are linked to a 20 to 30% reduced risk of the breast and ovarian cancer. So this is sort of an epidemiological correlation. And vitamin D has been known to inhibit angiogenesis, which is very important, and promotes apoptosis in malignant cells. Neurological and the mental well-being, protective role against depression and multiple sclerosis in women, and it has been linked to the chronic fatigue, often misdiagnosed in the clinical practice. Now, coming to the audience, which is mostly the gynecologists, reproductive obstetric care and high risk pregnancy. We talked about today high risk pregnancy, we talked about the recurrent pregnancy loss, we talked about the premature ovarian insufficiency. It has a dual requirement for the maternal and fetal development, required for the maternal health and the fetal skeletal development, and up to 96% of the pregnant Indian women are deficient, a public health crisis. That is why every gynecologist is happy to give vitamin D to any lady who comes to the as an antenatal visits. This is very important. And because you know the supplementation can reduce the risk of the preeclampsia by 40 to 50%. And the various mechanistic explanation is because of the different vitamin D deficiency causes decrease, impaired placentation, endothelial dysfunction, immune dysregulation, and again the RAS dysregulation. Any role in the reproduction? Well, because I talked to the endometrial receptivity is improved by the vitamin D and the implantation by the HOXA10 gene expression, which is a little bit improved. It modulates the inflammatory cytokines, reduces inflammation, increases the FSH sensitivity and progesterone production. Paracrine effects in reproductive tissues, deficiency disrupts ovulation and embryo quality. A big chunk of your practice, ladies, is the infertility. And the vitamin D deficiency reduces conception rate, even up to 75% fertility drop in animal models, and increases the miscarriages fourfold risk. Higher clinical pregnancy implantation rate in humans. That is why we do supplement vitamin D most of the patients who come for an antenatal visit. In the male, the vitamin D deficiency has been shown to reduce the sperm motility, progressive motility, and the normal morphology because it impacts the semen quality via the vitamin D receptor in the testes and the sperm. Sperm also is having vitamin D receptors. And the supplementation may improve parameters which can restore the fertility. Not any role in the preconception as a fertility support to improve the egg quality, for increasing the endometrial receptivity, and deficiency has been linked to the decreased fertility capacity in animal models, so we can translate the same thing to the human beings. ART, vitamin D deficiency and insufficiency are common in women undergoing ART as IVF. That is why any patient going for ART should be checked for the vitamin D levels. And their improved chance, some of the meta-analyses have shown that women who are vitamin D replete are more likely to achieve a clinical pregnancy than those who are deficient or insufficient. Now, what are the ultimate outcome in the live birth rate? Because the most important measure of ART success is the live birth rate. And it's a positive association. One systemic review and the meta-analysis found a statistically significant association with the replete women having 1.33 times higher odd ratio of live birth. And the vitamin D deficiency is a common modifiable condition that could be easily and cost effectively treated in women planning fertility treatment. Well, a most important topic for the endocrinologist, what we teach, the gestational diabetes mellitus. And we know the deficiency increases the risk of GDM. Early pregnancy deficiency predicts GDM, the South Indian cohorts. There are some good journal articles from the India also to show about the impact on the fertility. Fetal growth. Low maternal vitamin D is a predictor of the low birth weight and small for gestational age, and adequate levels ensures adequate calcium and transfer across the placenta. Preterm birth and spontaneous abortion are associated. The optimum will reduce risk of preterm if you have optimum vitamin D level in your body. And there's a possible role in reducing rates of spontaneous abortion by immune modulation at the decidua. Now, the vitamin D receptor polymorphism in pregnancy. There's a lot of studies from India too that the APA1 and FOCI polymorphisms are linked to the higher GDM risk in North Indian women, which has been proved. And that explains increased vulnerability to vitamin D deficiency, complications like metabolic issues leading to GDM, and similar association in other populations like Iranian women with APA1 and TAQI gene polymorphism. Maternal fetal bone health depends upon the vitamin D adequacy, and the severe deficiency lead to neonatal rickets and the impaired enamel formation, which is absolutely known to all of us. As endocrinology, we always see neonatal rickets in patients who are low socioeconomic status where they don't get the adequate sources of vitamin D. Low levels of vitamin D, I don't know what is the cause and effect. This primary cesarean sections are increased. A relationship between the when they saw the various records due to the impaired muscle function, increased risk of the pelvic muscle dysfunction. Postpartum health, again we come to the postpartum. There's high vitamin D during lactation, and you have to take at least 2,000 international units per day. And the deficient mother produce vitamin D, poor breast milk, risking the infant health. What are the screening protocols in pregnancy? You all of you know very well ACOG guidelines, FOXY guidelines, early screening for high risk groups, including those with limited sun exposure and where the body mass index is more than 30, and you have to achieve sufficiency early in the first trimester. Now, coming to the menopause and the fracture cliff, the most dreaded complication in the menopause because of the postmenopausal osteoporosis, because the postmenopausal estrogen decline accelerates the bone loss, and deficiency in this group is as high as 94% in India. Sarcopenia and the fall prevention. But vitamin D improves muscle strength and balance in the elderly. We can prevent the risk of falls as the primary cause of the hip fractures. Some of the emerging evidence suggests that vitamin D may inhibit the growth of the uterine fibroids, endometriosis, and inflammation because of the anti-inflammatory effects of the vitamin D may alleviate the symptoms of the pelvic pain in endometriosis. Menopausal vasomotor symptoms, low levels of vitamin D may exacerbate the severity of hot flushes and the night sweats. The obesity, we are all talking about the obesity. Obesity has become a national agenda nowadays. And you can see in last 1 month, there have been at least 50 podcasts just focusing on the obesity treatment. Vitamin D is sequestered in the adipose tissue, making it less available in the bloodstream. Obese women require 2 to 3 higher doses for the depletion. Urinary incontinence is a very common problem with the most of the gynecologists come across, and there have been some observational studies, postmenopausal studies, mechanistic research, where they have shown that vitamin D receptors in the pelvic floor muscles suggest a role of vitamin D in maintaining continence. Cardiovascular risk in postmenopause 1.5 times, and again the deficiency may lead to the CVD events more, including stroke and heart failure in older women. Chronic fatigue syndrome is a term we give the diagnosis, many of the patients where we don't know what to do. Many women presenting with vague pelvic pain and fatigue are severely vitamin D deficient. And lastly, but not the least, we are here. Walter Bushnell has revolutionized the technology of the vitamin D nanotechnology because of the various reasons I'm going to tell you right now. Because vitamin D innately is a fat soluble, leading to poor bioavailability. Traditional oil based preparation require high lipase presence and co ingestion with fatty meals. Conventional tablets, which were available earlier in a capsule, often leads to leakage of vitamin D molecules from the fat particles during digestion. High variability in cholecalciferol content exists across commercial Indian preparation. A very beautiful study from the AIMS. We have taken the different preparation of the granule preparation. All of them gave a different efficacy because of the different content exists in each formulation. So we have a vitamin D limitation of the traditional formulation, granules, tablets, and capsules, the soft gel capsule. But if you see the even the conventional nanotechnology syrup formulation, when subject to the high duration by GIT fluid results in breakdown, decrease in the number of micelles. The latest technology advancement and introduction to nano carrier and trapped vitamin D3. I think you are here very good vitamin D, battery with D3. And this is having four layers hydrophilic layer, enzyme resistant steric barrier, pH resistant electrostatic barrier, lipid nanocarrier, and vitamin D molecule at the core of the whole thing. So this is called equal nanotechnology, provides stable nanoparticle structure. And imagine the droplet size is less than 150 nano, significantly smaller than the conventional emulsion, which is less than 200. So it ensures the up to 90% absorption, protects vitamin D from the digestive enzymes and pH fluctuation in the GIT, direct delivery to the intestinal absorption sites and ensures rapid and efficient uptake. So, congratulations, Walter Bushnell, for having given us the Motivate D3 as the latest technology, and we can use this effectively in our day to day clinical practice. And there are studies where they have shown the four times raise in the serum levels in 8 weeks. The evidence optimal vitamin D level more than 40 nanogram in just 8 weeks. There's no need to give shots, which most of the people are very fancy. As an endocrinologist, we never prescribe the injectable 6 lakhs units, and that is only recommended when the patient is having malabsorption. Otherwise, there no role. People think we give a 6 lakh shot of intramuscular of vitamin D, it will raise the vitamin D level quickly. No, that is a misconception. So I never prescribe the shot of vitamin D. I always prefer to give the oral formulation, which is adequate enough to give the adequate level of vitamin D over next 6 to 8 weeks. So this was an Indian study which evaluated the equal nanotechnology vitamin D syrup versus conventional nano syrup in vitamin D deficient patient. And you can see the cause 5.5 times rise in vitamin D levels from the baseline where the conventional nanotech vitamin D syrup causes only 2.8 times in 6 weeks time. My dear friend R.K. Marwa has also done many other studies in the older formulation of the nanotechnology vitamin D. Now there is just a comparison between the conventional and the nano carrier and trapped vitamin D3. See the droplet size, bioavailability high, meal dependent, independent of the fat intake, absorption time is rapid, and levels of vitamin D is 4 times as compared to 2 3 times in the baseline. Simplified dosing, initial corrections, 60,000 units once in a week, but not more than 8 to 12 weeks. And the maintenance is just 60,000 per month. And most of the prescription I see loaded with the vitamin D. So we should not do that. Routine prevention, 2,000 units per day, which I am very fancy, just giving 2,000 per day. And monthly maintenance dosage throughout the pregnancy is the order of the day. High risk dosing, obese patient may require 2 to 3 times higher doses, and nano carrier technology is particularly beneficial here due to bypass of the traditional fat solubility. American Association of Clinical Endocrinologists, vitamin D in women's health, all women, PCOS, infertility, IVF, pregnancy, postmenopause, obese, and elderly women. So, to conclude my talk, vitamin D is everywhere with every disease. Name any disease, there is a role of vitamin D. And let's see what take home message you should carry. Because of the pleiotropic dominance, vitamin D is no longer just a bone vitamin. It is a systemic prohormone whose receptor dictates the health of ovary, endometrium, and the placenta. Achieving sufficiency is a prerequisite for successful IVF, management of the PCOS related metabolic dysfunction, and reduction of uterine fibroid growth. Adequate levels are the first line of defense against the great obstetric syndrome, the preeclampsia, GDM, and preterm birth. The lifespan length from adolescent peak bone mass to preventing the postmenopausal fracture cliff, vitamin D is a constant thread in the woman's wellness. The problem, the absorption ceiling, has been already sorted out by the latest technology, nano carrier entrapped, with a good bioavailability, rapid absorption, and a good amount of vitamin D level. Clinical advantage, predictability, simplified treatment protocols. And to end my talk, you have been listening very quietly. I think it is already 9:70, you might be feeling hungry. In every stage of the woman's life, from the first heartbeat in the womb to the grace of the golden years, vitamin D is not merely a supplement, it is a silent architect of our vitality. By optimizing this pro hormone today, we are not just treating a deficiency, we are securing the health of next generation. Let me hope from today onward, each and every woman sitting in this audience will start taking vitamin D as not as a tonic or as a vitamin, but as a woman's health from birth, to the tomb, throughout the all the years from the birth to the end of life after the menopause. Thank you very much for your kind listening. And it was my pleasure to come for the first time in this forum as an endocrinologist to deliver a talk in front of the beautiful women. So I am blessed today. Thank you very much.
Hello. Thank you, Professor Subhash Wangnoo, for a wonderful talk. And first and foremost, I would like to thank the Barlia family. It's we are a part of the family, I feel, So many years we have come here, all of us here. And like it is a very like annual scientific ritual for us. We would be very uncomfortable if we don't come here and meet and interact. And I would also like to thank Dr. Professor J.B. Sharma. He's been a fantastic beacon of knowledge and inspiration for all of us. And thank you for, please give him a big hand. And of course, our speaker is a very renowned and eminent figure. And I would like to say that vitamin D is very important. Believe in actually multiple micronutrient supplementation also for everyone. If I was, I think one day today it's actually a very important day for all of us because our Prime Minister, Mr. Modi ji, has launched the HPV vaccination and he's launched nearly 1 crore vaccines. I don't think anyone in the world has done such a thing before, and we must thank him and our beloved Health Minister Nada ji for doing this fantastic job. He launched it in Kota, and I have been given to understand that 2 or 3 crore additional vaccines will be also released. Who does that? Our country is a fantastic country. Imagine taking care of 1.4 billion people and their health, and it's an amazing job that our government is doing. And also coming to this, the actually every one of us should take vitamin D, but targeted screening. Maybe one day Modi ji will also make vitamin D testing free for everyone, so that those who
I
are
think
deficient.
in India we don't require any testing. Give whatever to everyone.
So
Everybody is deficient.
now tell me one thing, that if we give without testing,
There's
how many
no
doses we give?
same protocol. You start with every patient for 2 to 3 months weekly, and then followed by monthly as a preventive
Okay,
dosage
so
of
you don't need to
2,000 per
test. But
day.
what
No,
about hypervitaminosis, the fear?
with this dose you will never get the hypervitaminosis D
Okay.
toxicity.
So we don't need to test. We just need
Absolutely.
to give it, take it for all of us. Great. Thank you very much again.
Good evening. First of all, thank you, Walter Bushner team, for organizing such a informative sessions every year, and they provide a full uh, bout of information and knowledge at least for 1 year. So we are thankful to you. Thank you, sir. Regarding vitamin D, see, there are two aspects now. Vitamin D has been associated or has been implicated with all the disease processes nowadays. But how far evidences are there to find the causal effect relationship? That is, one has to be carefully look into and then see how much it will be going to affect the health of the particular individual. Number two is we all know in our country osteopenia is a very major problem, and we have to take care of osteopenia, and by correcting the homeostasis of calcium as well as vitamin D, a lot of condition can be taken care, and it obviously improve the health of the person or as a woman, and it also improves the pregnancy outcome. So these are the things which have been coming up in the literature as evidence, and more and more evidences are coming up where the association are found to be very strong. So we have to be very careful about our process of bone health and calcium homeostasis outside the pregnancy as well as during pregnancy also. Thank you very much.
I think Dr. Professor Wagner has done a very good job of highlighting the role of vitamin D. I think we all know it, and we are a vitamin D deficient nation. We know that also with rising levels of air pollution, and the UV rays are blocked to reach our skin, and that is why we in our country, I think we really need to address this problem of vitamin D deficiency, and because it needs a very 3 monthly or a 4 monthly injection is not going to help. So this nanotechnology that has brought, in raising the vitamin D levels to 4 times in 8 to 8 weeks, I think it is a fantastic thing. It's really a boon for everybody, because I also see in my practice that vitamin D is very low. Very often we come across levels as low as 5 6, and the patient just has very vague symptoms, chronic fatigue. She doesn't know where it is coming from. And we first of all, I used to think it is a protein deficiency, but then when we started getting it checked, we realized that it is vitamin D deficiency, and when we replenish it, the patients start improving. So this vitamin is very important for women, right from her when she's an adolescent girl to her young days, pregnancy, and then even in menopause. So I think I really congratulate Walter Bushnell for coming up with this very interesting molecule, which gives you a better bioavailability, because bioavailability is a big problem with other brands. It requires fat absorption, otherwise the conventional brand, and it requires magnesium as well. But now with this nanotechnology, I think we are going to achieve a much higher levels in a much shorter time without going for repeated tests. So it's a very good molecule.
Thank you, Walter Bushnell and family, for inviting. It's always a pleasure to be amongst the August audience. And today's topic, a very important topic, something we all need to look into our patients when we see them day to day. We check their hemoglobin, we check their thyroid, but do we really check their vitamin D? It's still not in routine guidelines internationally, but it's important, and the talk has highlighted that. Cases of low AMH, male infertility, polycystic women, we are doing PRP, stem cells, TESA, micro TESA, ovarian drilling, but perhaps supplementing with this simple molecule will help them immensely, much more than many other treatment, much expensive treatment that is going to this patient. But of course, a word of caution, and I completely agree with Professor Ashok Kumar, who has highlighted that most of these studies are associations. There are few randomized controlled trials, not very much in the subcontinent. and all of us here should take it as our responsibility to prove it with much more stronger literature. But I'm sure vitamin D is here to stay, not only for young children, for young ladies, and also for the perimenopausal and menopausal women. Thank you very much.
Thank you, sir, since I'm the last one. So I'll just very quickly, wrap up. And thank you, ma'am. If you remember 22 years back when I came to Delhi, then with Mr. CM Chabra, I think you were one of the first ones I met and made some modules for Walter Bushnell. And I'm so impressed by seeing such keen, delegates sitting and hearing so patiently. I would say that number one, to begin with, we must estimate vitamin D levels. We need more robust studies to know what are the cutoffs in Indian population in different segments, because we are still following the Caucasian world. Without estimation, I think incessant prescriptions should not be given, because there is a positive side, which even, when this topic came in, I thought, what is the pleiotropic part of vitamin D? And then I realized, oh my, from top to bottom, everything has a receptor in the body. Yes, it works well. We need to identify who needs a higher dose, who needs a lower maintenance dose. And not to forget, I think lifestyle management and weight bearing exercises is something which should not be forgotten at all. So it's supplement, it's lifestyle and weight bearing exercises which need to go hand in hand. Thank you so much, Walter Bushnell, for coming up with a wonderful molecule. I'm sure in ages we are going to see wonderful effects, and we would love to do some studies, especially in the male infertility, looking at two arms, one getting only antioxidants and one getting antioxidants with vitamin D. And if that shows a very, very positive effect, then we know for sure that vitamin D is here to work for long. So thank you so much to make us a part of this wonderful session.
I think before the closing session, I just want to make a very important statement from this podium.
Before that, ask you one thing so that you can add to the
Yeah.
answer. Hello. With all this new weight loss medicines, do you think we need to supplement vitamin D in those as well?
Yes, it's a very important topic because all the newer weight loss agents, the GLP-1 receptor agonists, apart from the fat loss, they also cause sarcopenia, means the muscle mass loss. And vitamin D is important for the muscle strength. That is why we tell our patient whenever you are on the treatment, take high protein diet, do resistance exercises, muscle building exercises, so that you don't get sarcopenia and they'll be fall because of the sarcopenia. You will land up in the fractures. So we supplement all of them with the vitamin D and calcium. Why I wanted to make important statement, because I'm very happy today my Guruji and teachers are on the audience. Professor L.K. Pandey and Sulekha Pandey, they are sleeping right now. Yes, sir. And I must pay my tribute and respect to them. They had taught me from the Banaras and the university, the very famous gynecologists. And as I'm lucky to have, they are here and listening to my talk. Thank you very much.